All women go through menopause, but many want to know when it's happening. So how does a doctor diagnose the change?
Unfortunately, the only sure sign that a woman has entered menopause is that she has gone 12 months without a menstrual period with no underlying medical reason. Thus, a woman whose menstrual periods have become irregular should start tracking them on a calendar to share with her doctor. Yet, many women want more concrete and quicker evidence that they are indeed undergoing menopause. There are several tests that may help offer conclusive evidence. During perimenopause, which precedes menopause, the ovaries begin to produce less estrogen, in turn causing the vaginal walls to thin. A simple pap-like smear will allow a doctor to diagnose vaginal atrophy, which is the thinning and drying out of the vagina. The results, in conjunction with careful menstrual cycle records, may help your doctor to identify menopause. Another test which may help in diagnosing menopause checks levels of follicle-stimulating hormone, or FSH. FSH is a hormone released by the brain's pituitary gland to trigger estrogen production. But during menopause, FSH levels elevate slightly as the body attempts to stimulate the ovaries to produce more estrogen and maintain the menstrual cycle. A doctor can determine how much FSH a woman has with a blood or urine test. Home menopause testing kits are sold in drugstores. These require a urine sample, which also tests FSH levels. No matter where an FSH test is done, however, it's important to remember that the results are just one component of identifying the onset of menopause. To make that diagnosis, a doctor will also need to perform a complete medical history and physical, as well as study a woman's menstrual records and lab results. As a doctor runs tests to determine menopausal onset, he or she should also look into a woman's bone density. This is because lack of estrogen contributes to bone weakening characteristic of osteoporosis. A bone mineral density test, or DEXA, can quickly measure the amount of calcium in bones, in turn showing a doctor how strong they are. This test can be performed by several methods, including an X-ray or an ultrasound. While menopause can be a challenging time for many women, enlisting the aid of a support system, including medical professionals and other women, can help. If you have concerns about menopause or its symptoms, please make an appointment with your doctor today.
Want to learn more? Check out other videos and sources on this site for more information.